Good morning and thank you for being here. I'm Rod Brenby, Secretary of the Kansas Department of Health and Environment, and we at KDHE are pleased to join Governor Parkinson, the American Heart Association, Representative Keither, in speaking about cardiovascular disease in women today on National Wear Red Day. I would especially like to thank Kathy Porter from Overland Park, who's agreed to be here and tell her inspirational story about surviving heart disease. If you think cardiovascular disease doesn't affect you or a loved one, please consider these statistics. Cardiovascular disease is the leading cause of death among women in Kansas and the United States. In 2008, 4,252 women died of cardiovascular disease in Kansas. That's 1 out of every 3 deaths. Fortunately, cardiovascular disease is largely preventable. Healthy behavior combined with preventive health care can reduce the number, but not all, but a significant number of Kansans who are at risk for heart disease. We all need to become more aware and act to control key factors that increase our risk of heart disease, such as smoking, high blood pressure, high cholesterol, obesity, physical inactivity, unhealthy dietary habits, and diabetes. Did you know that secondhand smoke causes more than 2,100 heart attacks in Kansas each year and kills 400 Kansans? In a State of the State address, Governor Parkinson spoke about the importance of having a Clean Indoor Air Act, a ban on smoking in public places. His address was an urgent call to act. A strong ban on smoking in public places, the Clean Indoor Air Act, is gaining momentum in the legislature. It has already cleared the Senate, and this is incredibly good news for the health of all Kansans. We're pleased to have strong leadership represented in Governor Parkinson, and now it is my privilege to welcome Governor Mark Parkinson.
Well, I'm very happy to be able to participate in this event today. As Secretary Brenby has just indicated, heart disease continues to be the major killer of not just Americans, but of Kansans. And the good news is that we can prevent a lot of these deaths. Unfortunately, despite the fact that we have the knowledge on how we can prevent these, we haven't made significant progress. As Secretary Brenby indicated, we can prevent cardiovascular deaths through changing our behaviors, stopping smoking, changing our diets, just generally living a healthy lifestyle. But there are other things that we can do as well. The most significant thing that we can do this year in the legislature is, as Secretary Brenby talked about, passing a meaningful public smoking ban. You know, we have so many proclamations and celebrations in the ceremonial office, and that's all great. But often when I leave them, I wonder, have we really made a difference? Have we really decided that we're going to do something as a result of this proclamation or as a result of this ceremony? My hope is that this year we will make the decision to not just come here and talk about heart disease, but to really make a difference. And the most meaningful thing that the Kansas legislature can do this year is pass a real public smoking ban. I was concerned when I came into the legislative session that the tobacco industry would generate a meaningless public smoking ban so that legislators could vote for it and act like, in fact, they had voted for a public smoking ban when, in fact, they hadn't. Well, my fears were not only realized, they were actually made worse. Because in the last couple of days, the legislature has introduced, and I suspect the tobacco industry wrote it, a so-called public smoking ban that not only doesn't ban public smoking, it repeals the ordinances in communities that have had the courage to actually ban public smoking. It is a ridiculous piece of public policy that is nothing but a fraud on Kansas citizens. Well, here's the good news. The public is smarter than they think. The public can tell the difference between a real public smoking ban and something that just pretends like it's one. We know from polling that a vast majority of the Kansas public wants the legislature to enact a real public smoking ban. And I would ask all of these legislators to go away from today, a day where we talk about cardiovascular deaths, and not just leave it as a day where we've done that, but instead leave it as a call for action and finally give Kansans what they want and what they deserve, which is a real public smoking ban.
Governor Parkinson, it really is truly a joy to be here today in the state capitol to celebrate National Wear Red Day, but also to celebrate American Heart Month. And so as a token of our appreciation, we want to thank you and the First Lady. Here is our official Go Red for Women tie with a red dress on it, and it takes a real man to wear a red dress. And a gift also for the First Lady, so thank you so much.
Thank you very much. My staff is always complaining that I wear the same tie too often, so I will wear this.
Perfect, thank you. Well, we're here today because we're choosing to speak up about Americans' heart health. Heart disease is the #1 killer of women and men, claiming about as many lives as the next 4 causes of death combined, including all forms of cancer. But the good news in all of this, 80% of heart disease is preventable if we make the right choices for our hearts. That's why we're here, to speak up about the choices we can make that will save lives and change lives. As Governor Parkinson explained, clean indoor air is an essential component to improving the overall cardiovascular health of individuals and will lead to saving the lives of thousands of Kansans each year. So why is this so important? Well, a recent study by the Kansas Health Policy Authority estimates that nearly 4,000 Kansans die each year from smoking-related diseases. Just think, 4,000 Kansans each year. That's 4,000 mothers, fathers, grandmothers, grandfathers, sons, daughters, co-workers, best friends. Think of the lives that we can save this year if our elected officials choose to step up to be leaders in this effort. The American Heart Association urges the Kansas legislature to enact a comprehensive clean indoor air law today. And to the citizens of Kansas, I personally encourage you to speak up and contact your elected officials to encourage them to support statewide clean indoor air legislation. It's time for Kansas.
Well, microphones were all under everybody else. Now they're... well, I was just thinking in the office just a few minutes ago that how long I've actually been promoting this day. And it's closing in, I believe, on about 10 years now. Hard to believe how much time has gone by. And what a pleasure it's been. The number of men that have Red on, we didn't start out that way because it wasn't an issue for men. And that has been something that I've pulled in for the men in the legislature that, yes, it does affect them because it is a mother, sister, wife, daughter that could possibly be affected by this disease. And yesterday, in the House and the Senate both, resolutions were passed for the effort for the American Heart Association in reducing women's heart disease. We voted to urge all Kansas citizens to show their support for women and the fight against heart disease by commemorating the day by wearing the color red, which we certainly did. I'm wearing red again today because it is the actual day, and speaking up again in support of this very important issue because it does remain the #1 killer of women. So it's time for all of us to speak up for ourselves, speak up for others. We must shatter the silence in choosing to speak up about heart disease. Speak up, spread the word, and we can help save lives and save the loved ones that we care so much about.
Regardless of any statistic that's thrown out there, so many times we say, that's horrible, but it won't happen to me. And that's exactly what I said 11 years ago, but it did. Heart disease doesn't care what you wear. It doesn't care how old you are. Heart disease does not discriminate. I became a 44-year-old woman struck by heart disease, and mine was preventable. When you smoke, for women, when you smoke, your chances of a heart attack come 20 years earlier than in a non-smoker. On that day, we had just finished having lunch with our friends when I started experiencing some of the worst chest pains, which I thought was indigestion, that I had ever felt. I wasn't sure it was indigestion, but not sure what else it would have been. At the time I had my heart attack, there were only 2 symptoms that had been communicated, and that was pain or tingling in your left arm and the crushing chest pain. Well, I only had the crushing chest pain. But what I learned later is that, like many women, I had most all of the atypical symptoms. back pain, unexplained fatigue, jaw pain. I had cold sweats, but yet I was hot, and I had lost all of my color. I was a wife and a mother of two, 11 and 14, and I sat on the floor in a restaurant in Manhattan, Kansas, waiting for the EMTs to arrive, and I didn't know if I was going to live or die. But all I knew was that my kids still needed me and that I needed more time. I was scared to death. But the worst sound that day for me was as they took me out of the restroom on the stretcher and listening to my daughter began to cry as that happened. You know, and I could have prevented all of those things from happening. I suffered a massive heart attack that day, damaging the heart muscle and leaving me with multiple conditions that I would have to live with for the rest of my life. A cardiac cath was performed that same day, and the doctor said, I have good news and I have bad news. The good news is you have no blockage and you do not have coronary artery disease. The bad news is we don't know what caused your heart attack. Well, it was discovered later that my heart attack was caused by smoking. I have learned many hard lessons through my experience, and that is why now I am an advocate for a smoke-free environment. Not only do people who smoke really not understand the seriousness of their habit, but too many people are also dying of secondhand smoke. I am asking that each of you and your families become part of the American Heart Association's You're the Cure campaign. We need to be more responsible for the health of our younger generations, and we need to be more responsible for ourselves, becoming healthier as individuals and living in a healthier community. Thank you.